Welcome to part 3 of our roundtable panel discussion with our subject matter experts and colleagues in the area of bioanalysis, both in pharma and CRO. And we're going to continue the conversation a little bit about people and community. And I'd just kind of like to open up with a conversation around mergers and acquisitions. So we've all been in the business for a while, and I can speak for me personally. I know I've had a number of different business cards, and I've had different business cards even when my job didn't change. And I have some thoughts on what that community means in those partnerships that affect us personally, but then also have an impact on our business as part of mergers and acquisitions. So kind of an open conversation around M&A, but I know it's something that's very relevant, and share the good and the bad to kind of get the conversation started.
Well, those that have been in pharma, those mega mergers of the 2000s and late 1990s still leave marks. The massive downsizing that ensued with some of the failed mergers, that obviously created an opportunity for CROs to pick up talent and to create those organisations as the larger companies were looking for reducing their R&D spend, and that's where looking for opportunities to outsource the sort of commoditised activities like bioanalysis. So what sprung up with the standalone bioanalytical CROs, it was sort of a plethora of labs that just popped up everywhere, and it really just absorbed the talent that had exited large pharma after these mega mergers. So I'd be kind of curious to see what the CRO business has been like in the M&As, but certainly on the personal side, it's been the large pharma mega mergers that have sort of left quite a mark.
Yeah, Roger, that's very interesting. Actually, I agree with your comment that the impact, I think to me, at least for the CRO bioanalytical world, the impact of the pharma mergers, acquisition, and unfortunately laying off a very good group of scientists, these individuals have moved to the CRO sector. And today, if you look at it, the CROs are not just extra set of hands. They're actually, we are partnered with the pharmas and biotechs because the brain power is equally distributed, right? And so in that sense, I personally think it has actually been a good thing overall, although painful for some individuals, I get that. But for overall drug development, I think it has been positive. We're going to know over the next several years, right? Now, from a perspective of, we're in a global world, and everybody's looking for a acquisition possibly because they want to get from point A to B rather than organically. They want to go and get there faster. Not necessarily sometimes cheaper, faster. And for us, so we, for example, acquired a company in Germany. And for us, it was the acquisition, in CRO, we don't own a drug, right? It's the IPs, it's the people, the knowledge, right? And the client interaction that they have. So for us, we actually acquired a lab to now have a foothold in US and in Europe to be able to support the clients. I can tell you one thing is that you always hear about the merger and acquisition, people getting laid off. But because of this merger and acquisition that we did, we're going to actually now probably going to triple or quadruple the size of that laboratory. So the side that people don't hear is that all the hiring that is also taking place. So at least I'm proud of, at least for our merger and acquisition, we're expanding our services and also creating additional job for good talents.
I think that's the CRO space where you actually see an M&A driving the growth of a company versus in a large pharma acquisition. It's really about, well, how do we get those synergy cuts? How do we reduce the R&D? How do we leverage what the assets that we purchased, and not necessarily those assets being the human capital?
Any thoughts from the pharma side?
Yeah, I also see this merger definitely has impact both sides, can be positive and also negative. Negative is it affects people's a lot of people morale. So at that time there's a certain period for uncertainty. So people worry about the job security in pharma because when you have a merger, and then obviously there's the next one will reduce redundancy, so people worry about that. But at the same time, also create a new opportunity. Then you can how to make your organization more lean and more how to become more productive, and also I would say for individual, and also it's a lot of opportunity to look at your job beyond the farmer. So a lot of people that at the end, and then they look at, they force them to look at opportunities, and then they end up actually quite happy. They say, yeah, no, I didn't think of it. I was too comfortable in pharma for a while, and I didn't really actively to grow myself and to prepare now. Because of this, I have forced myself to learn new skills and then to get the new opportunity and grow in different ways. So
Yes, essentially reinventing yourself.
Exactly.
And I think we should not forget about the couple hundred biotech that at least have started in the past few years in Boston area.
That's right.
So anytime there is change and shake up and pain, there are also opportunities and doors that open up. So the reality is good, bad, or ugly. It is the reality of the world we live in, right? And I think it would be interesting to also discuss a little bit around the some of the acquisition from overseas and some of the I think that's those are I would say some countries are definitely investing more and more into their CROs, into their biotechnologies, and they're really looking for foothold, at least I know, in U.S. market. So it will be very interesting over the next several years. What would be the impact of that now?
Right.
Companies from overseas owning, I would say, a good number of companies in U.S.
Right. Well, just that footprint, you've always thought that, well, if you're a US-based company, how do you win or attract sponsors from Europe, for example? Do you need to have that foothold in that country to actually generate business? Why would somebody want to interact with somebody in the US if they're a European sponsor? Is there some sort of issue with that, shipping samples over? So do you really need to look at an acquisition or some sort of opportunity to gain that foothold, whether it be in Europe or in China or something like that?
Yeah, so for the last 8 years, QPS went through 6 M&A, going across from Europe into US, into Asia. I would say that the actually most interesting component is actually not the acquisition or the merger itself. It's actually the continuous demand for organic growth within each subsidiary. And actually the cross-fertilization, because there are some differences between each organization, and the skills is a little bit different. So that actually has been surprisingly fun for me, I would have to say. And then for the M&A from the pharma side, that also sort of good and bad, right? So the good is that there is definitely opportunity that for new careers for multiple people. Sometimes works out better for others. I think from my perspective, the scariest part is actually when you have one client that was pretty healthy, you have another client that's pretty healthy, you have another client that's very healthy. When they merge after 1 year, second year, third year, now you have a client that takes up 60% of your revenue, and you sort of start worrying about what that means, right? So it gives you a very different perspective of life, and you would never believe that would happen a few years ago, but it really is happening. But I think overall, I would say I think people are learning to manage M&A a little bit better, whether they are US based, European based, or Asian based.
Yeah. And I think one other thing about the merger and acquisition, let's not forget about the mergers of very large CROs that has taken place, right? And I'd like to hear from our pharma folks here. If I was in a pharma and I see some of these very, very large CROs merging, do you look at it as positive, negative? Does it worry you? It would be interesting because, what would you guys think?
I can speak. So yes, of course, we've worked with our CRO partners and have experienced that. I think both internally and also with our external partners, mergers and acquisitions are here. They're going to happen. And I think where I've seen the best experiences are where, again, the focus is based on the work that's being done. And so with our CRO colleagues, when they maintain that stability of the data being generated, the reassurances that the service that's being provided is still going to be consistent, is still going to be of high quality, and what our expectations are, then we rest assured, we can kind of breathe a little bit easier and to maintain that. And similarly, again, in some cases, there's change in the individuals that we work with, right? And those are personality and personal relationships that are built with the principal investigators. And those are things that are difficult. But in some cases, they actually are maintained. So then it almost seems seamless for us if those individuals actually transfer as well. I think, again, from a biopharma perspective, where I've seen successes is where management, again, because how many times this occurs, they get training and they impart that kind of training as well as change management during the process. So they realize it's not just, these are humans, these are people, they have lives, how they're impacted, and emphasizing that. And for whatever they can, actually looking at the culture. The culture of the company and who's coming in, they realize that to get the most out of these employees, they need to own that culture. And it's going to behoove the company as a whole for them to help support all of those employees to maintain that culture. I've certainly felt that, in 2009, for example, when Roche completely took over Genentech, I felt like there was a commitment to maintain that Genentech culture that had been built upon from many, many years.
I like the points that were brought up around like the personal nature, right? So people work with individuals. They don't necessarily work with organizations. So I think one of the ways that to successfully transition and when following M&A is to make sure people know your study director is the same person, or your analyst is the same person, or the people you're working with haven't changed. Maybe the title on the business card is. So I think that's part of that partnership that's happened at a very personal level, that people feel ownership in the programs. So it's encouraging to hear you say that from the pharma side, because that's something I definitely see from the service provider side at Charles River. Maybe just there was another point too regarding is this merger is it going to be good or bad? And it's all it's two sides of the same coin, right? So I've seen examples where there are acquisitions of, say, smaller, more niche contract research organizations, and the one side of the coin is we're going to lose the speed, right? Because now it's part of a bigger organization. The flip side is, hey, this is great because now they have there's this smaller, more nimble organization, but now they're scalable because they're part of a larger organization. Right. So it's all of it's about managing perception for a large part, because again, they're the same issue, just two sides of the coin, right?
Right, it just kind of depends on what company's been acquired or merged with. Are you adding capabilities, or is it just consolidating a competitor that you're now basically become one company? So I guess it just depends on what the primary goal was for that merger and potentially acquisition. I think from an MPI perspective, it's more about adding the capability. Exactly. We've got good strength in a certain area, but hey, what about some strength in a different continent? Maybe Europe or something like that. Is that something we should be looking for in an acquisition? But anytime you do an acquisition, it's always thought of as being destabilizing, because you do have to integrate. And as much as you'd like to maintain those relationships with the sponsors and to say, look, it's the same study director, that individual's distracted. You're always looking at, well, okay, we've got to get those SOPs together. And geez, our interpretation of the guidance is a little bit different. And so that's always part of it. But I think the really good managers and good CROs are able to sustain that relationship with the sponsor. We're always part of that team.
I think, Scott, I heard this from multiple folks here, and I think you said it also about the culture, right? And to me, again, I can speak only for the CROs. I know, again, the pharmas, they buy each other. It's usually around the IP of the drug, right? That you want to have that pipeline, and you want to have the knowledge, in that case, and the culture, right? And I think, Roger, you mentioned that very nicely. Also around you buy it for bringing new platform system or service offerings. But to me, part of it, at least I can tell you that when we were looking for our acquisition, we looked at probably over 30 companies. and then and because we identify based on the geographical location where we need to expand. But the number one factor for us was the culture of that company, because we did not want to have two separate culture in two continents, two separate set of SOPs and two way of thinking. It was one of those that we looked at that company's culture. And the culture can be defined in many different ways, right? But we looked for some way that we can learn from them, they can learn from us, but at the end, it's one company, right? So it's interesting, you know, when you made the comment that when Roche bought Genentech, they let Genentech maintain its culture, because Genentech has been doing really well, right? But I would say most of the companies, they try to synergize, harmonize the culture. And that's where things fail.
That's right.
It's not because, you know, all of a sudden one of the clients was upset and left. It's the cultural merge that you gotta do. So interesting.
And that's what, you see that a lot in the pharma mergers, those mega mergers. It's more about the gaining of the asset, right? And you know, the combined pipeline is so much better than the individuals. And I think that's the difference with the CRO, because it's more about getting the right partner, you know, so making sure that the cultures do mesh, maintaining the relationships with the sponsors, and that's a key part.
For us, you know, we came up with a simple statement, said anytime we look at an acquisition, it got to be 1 + 1 = 3.
Right.
You got to bring something in there that it just not additional revenue. It's not just additional few clients or talent. It's just together. Now we can offer something that neither one of us could offer separately. So, but again, that's a little bit different in the pharma world, right?
I mean, I agree with what you're saying, and in terms of in this day and age when you're working in a global organization, you inherently have to have sort of subcultures if a company is global, right? Within each country, they're going to have the culture of that, you know, community where they are. And I think having that common thread, yes, that's going to be the common culture, which is the mission statement, the vision of that company. And if everyone's on board from that perspective, that really helps. So, you know, at Roche, doing now what patients need next, we all share that same vision. But, you know, whether it's the casual intensity at Genentech that maybe, you know, we don't all suit up and have suits and ties necessarily, you know, that part is not necessarily required for the mission statement that we all share, right? So that those aspects of it, if you can leave well enough alone and not disrupt, you know, certain parts of it, I think helps all around. But then you do have the synergy and you do have to mesh, certainly, I think, across.
So for us, for CRO acquisition and how impact pharma, actually in most of our experience actually quite positive. We feel a lot of time we had a stronger support. I think a lot of time it's how not just a merger and how to handle merger, the process, not to disrupt your support, your relationship with the sponsor. That's very important. And we feel actually most merger actually, I think CRO and care about that, not a negative effect. Even you bring the more value for the support, because you have more capability and more locations, so we don't have to look for different company, and also more simplify and interface channel. Actually, because you all have more stronger and support within the company.
You know, the one area of merger and acquisition that makes me nervous is when I have a kit supplier or when I have instrument supplier, right? On one hand, I go from maybe a small innovative company that was producing this platform and these 20 kits or whatever antibodies, and when they get it, you know, when get engulfed in a much larger organization, it always makes me nervous because again, my client rely on me to be able to support the studies based on that platform and those reagents. And recently there was an acquisition of a reagent kit company, and I was supporting a client overseas, and it was we're halfway through the clinical trial. The kit is not being sold anymore, and that's very painful, right? So that's one area that unfortunately we will have no control. But there have been also acquisition of instrument companies that now you have better support over those instrumentation, right? So that's another area of M&A that I think, you know, I personally keep close eyes on and try to at least get a heads up as much as I can if I'm supporting using certain reagent instrument to support a study.
Well, thanks again very much, and we appreciate your time, and I appreciate everyone's contributions. Thank you.
We did have a child randomly in the middle of that.
Cat or a child or something.
I think it was a baby, but